Well, good afternoon, everyone. Thank you for joining us for our Molina webinar. And I'm happy you were able to make it today to listen in on Jonathan's presentation. And we will hopefully learn something maybe you didn't know before. So just a little bit of information. So I am Sharon Fourcha with IAD. I'm the broker manager here. So if you have any questions during the presentation, go ahead and put those in the Q&A. And I think we're going to go ahead and get started. So I would like to introduce Jonathan. It looks like 𝗬𝗂𝘂 has joined us as well from Molina. So I'm going to take the reins over to them and let them get started on their presentation to be conscious of everyone's time.
My name is Jonathan Roldan, 𝗬𝗂𝘂 Jackson, broker channel managers in the state of Michigan. I'm over handling the eastern portion of the state, and 𝗬𝗂𝘂 is handling West Michigan. So we just thank everybody from IAD that is either joining us live as we record this or is listening on the recording, and just thank you for being here today to learn more about Molina Healthcare. We're here to answer any questions that you may have. So, okay, so everybody can see the screen that I'm sharing. There's a little picture of myself and 𝗬𝗂𝘂. Again, this is on the Medicare side as we review the 2024 products for Molina Healthcare and talk a little bit more about Molina. You can see our favorable ranking, 125th, Fortune 500, with over 5 million members. We were founded in 1980 by Dr. David Molina, and he really had a heart for the low-income population as an ER doctor in Southern California. And hence, we started out as a Medicaid company and expanded since then to the 3 M's under Molina: Medicaid, Medicare, and Marketplace. And you can see we have over 15,000 employees with a favorable stock price. We'll talk about that in a little bit. And then you can see the intentions of Molina Healthcare, which are to improve the health outcomes of our members, enhance the member experience and the provider experience, as well as reducing health costs, as well as enhancing you, the broker's experience as well, by working with 𝗬𝗂𝘂 and I. In 2024, we are in many states and potentially look to go into more states. This represents the current states that we're currently in. The blue specifically, we've exited 2, which are in pink or salmon, whatever you want to call that color. Florida, New Mexico are the states that we've exited, and it looks like we will come back, more to come in New Mexico as we have gained a Medicaid contract. That's why we lost the state of New Mexico. So all told, 660 counties for 2024, and to talk a little bit more about Molina on a national scale, we, like other carriers, like to grow by acquisition. And this year we did acquire Brand New Day, or Bright Health, which is located in California, which is expanding our market in California. So that's our big acquisition for this year. And internally, there's a lot of things that are going on behind the scenes in trying to make that specific market in California grow, which we are already doing because of their close of MMP. We also typically, though, like to grow organically. What does that look like? That means 15 RFP, request for proposal, Medicaid contracts over the next 3 years. We won't win them all, but we intend to win most of them. And when we do that, we like to grow our Medicaid first over the course of 1 to 2 years before inviting Medicare and usually our DSNP. So again, if there's any questions, feel free to put them in the chat or interrupt me. 𝗬𝗂𝘂 and I are here to answer, as well as Sharon's here to man the chat also. Oh, before I go into this slide, let me just tell you, we are broken down into regions. Michigan is part of the Northeast region, which is comprised of New York, Massachusetts, Michigan, Wisconsin, and Illinois. We have broker managers. Again, we're handling the broker channels portion of the Medicare side in 3 of those states. Now we go to this slide right here, which is all directed by Michael Kane. Javon and I, as I mentioned, man the state of Michigan, and then you can see our broker managers in Massachusetts, Bill and Ferdy in New York. If you have any questions on any states you may do business in outside of Michigan, please tag Javon and I. This is our contact information, and we can get you to the correct broker manager. Now, as we double down into our state, this is our service area for 2024. We're not in the Upper Peninsula, but we're only in the Lower Peninsula, and the blue represents our service area plus the gold expansion counties up north, Sheboygan and Presque Isle. The gray counties are the counties that we do not service in 2024. We're easy to do business with. We have only 4 plans, which makes it easy for you to understand Molina Healthcare. Those 4 plans are the Molina Medicare Choice Care and Choice Care Select. Up at the top, the 2 red dots represent our 2 MAPD plans for 2024, and the Molina Medicare Complete Care and Complete Care Select at the bottom, which represent our 2 DSNP plans, which is what we're known for. Why we're easy to do business from a service area is because we're also easy to understand. We have all 4 plans in all counties that we service except 4. So it's not like we have this particular plan in this county, this particular plan in this county. All 4 plans are in all counties that we service except 4. Those 4 counties are in Mid-Michigan, Isabella, and Midland, and in West Michigan, Barry, and it's escaping me right now. Mason, Barry and Mason. Sorry about that. And now we dive into our plans. First with the DSNP, because that's what we're known for. The 001 on the left side of the column, you can see the Medicaid level eligibility guidelines for that particular plan, as well as the one for the Complete Care Select on the right side, which is the Medicaid level eligibility for the partial plan, which is a spend down plan. Of note, even though those are eligibility guidelines because of what's gone on with Change Healthcare, please note if you contact our BSU, they won't give you the actual Medicaid level of eligibility, but if you give them name, date of birth, or if they happen to require, I don't think you need this, but if you give them the Medicaid or MBI number, they will just give you the actual plan that the member qualifies for Molina Healthcare, which is really all you need to sell with Molina Healthcare. So with both plans, these are both 0 plans. And just going over high-level highlights, under extra benefits for dental on the full DSNP plan, you are looking at over $4,000 allowance per year for comprehensive coverage through the dental vendor. The dental vendor in 2024 is DentaQuest. And keep in mind that does not cover implants. With fitness, Silver and Fit is the vendor that we use for our fitness. Hearing is Hear USA, and we do have a relationship with Best Buy relative to the hearing. There is no dollar amount. And then as their vision is with VSP. And then you can see for both plans, worldwide emergency urgent coverage up to $10,000 per calendar year. The hot topic this year, or over the last 3 years, is the debit cards. And with us, it's a little different. So opposed to our competitors, ours are in buckets. You can see those buckets are food and produce, OTC, and SSBCI, which stands for Special Supplemental Benefits for the Chronically Ill. That includes service animal supplies, mental health and wellness apps, non-Medicare covered genetic test kits. And those buckets, some are in monthly as a food and produce, the other two are done quarterly. But we've done the math to kind of help you figure out with all the other carriers that have it done monthly. On the full DSNP plan, that works out to be over $220 per month, and the member does need to qualify for that. On the Complete Care Select, which is again the spend down plan, you're looking at again going down to the My Choice card, over $160 per month if the member qualifies, and they need to qualify for 2 of the 3 buckets, although it's all one and the same as far as the qualification process: food and produce and SSBCI. The dental I will save for later because that's a little different from the full DSNP plan on a different slide. On the MAPD side, there are 2 plans, the Choice Care and the Choice Care Select, or 006 and 007. Now keep in mind, on this particular plan, there are 6 tiers on the prescription deductible. Most MAPDs have 5. You'll find the 6th tier has the most common generic medications. Even our DSNP only has 5 tiers. Again, hearing aids are great. And then if you kind of go down to the bottom on the My Choice card on the 006, again, member needs to qualify for food and produce and SSBCI. However, the $55 a month, you won't see that not normal in any MAPD. Again, you're looking at over $140 per month in that bucket, which is not combined, not to sound like a broken record. It is in buckets, just again trying to compare to different carriers, which all the carriers except us do it monthly. The give back plan is the 007. Last year we were the highest in the market at $105. We went up to $110 given back in the Social Security check in 2024. It is a little more bare bones than our other plans, but does have $50 per quarter in OTC and a fitness benefit as well. Network is a strong benefit, we believe, for Molina Healthcare. We're in all the major networks, as you can see here. Network is not an issue. It's probably easier to talk about our gaps, so to speak. In Kalamazoo, you can see we're in Borges, but we're not in Bronson. We have a great relationship with Oak Street, but we're not in network or with dedicated or ChenMed, since they have a 5-year contract that expires at the end of 2025. Any other holes or gaps are really due to either a provider who pars with any of these networks or a practice, but they have the choice not to par with Molina Healthcare. Please tag, text, phone call Giovanna and I, or if that's the case. We do have access to internal programs that you guys do not, as relationships with our networks team that you guys do not, where a provider may be showing out of network, but they're actually in network. At the very least, we'd like the opportunity, if they're not in network, to try to recruit them to become in network with Molina Healthcare. All right, as we move on, let's talk about and pivot towards HRA. So before I kind of talk about the slide, CMS has ruled that at the end of this year, HRAs, or at least the payments, will be going away. We currently pay $100. Some of our competitors, both nationally and some of the state carriers, have said bye-bye to the payment of HRAs. I think Priority Health, theirs has gone away. WellCare has gone away. Aetna is going away at the beginning of June. We have had no news about ours, so it's business as usual relative to our HRA paying $100 per enrollment, at least till the end of the year, or until you hear notification from Molina Healthcare. This is a very good process relative to trying to obtain those additional benefits for the member. How's that done? Once you complete the HRA, which, by the way, we do use 𝗍𝗂𝗋 as our vendor to complete a an electronic HRA. So the process is laid out here. You enroll use a broker to enroll the beneficiary or the member into one of our Medicare plans, specifically one of the 3 plans. You complete the HRA, as I just stated before. Member does get 2 cards, the member card and the debit card. That card gets activated, and then the member needs to contact our member services department, which you will get at the near the end of the presentation, to try to qualify for those additional benefits. Chronically ill conditions are not as bad as you may think to try to qualify. I'd say at least 9 out of 10, if not more, do qualify. The member services does a warm transfer over to our case manager, who really holds all the power in evaluating not only the HRA, but possibly contacting the PCP and interviewing the member. Once the case manager makes an evaluation, presuming that they accept and authorize that member, they'll authorize those additional funds, which again is the food and produce and the SSBCI benefits to be authorized into that member's debit card. Those CMS chronically ill conditions include chronic alcohol and other drug dependence, autoimmune disorders, cancer, cardiovascular disorder, chronic heart failure, dementia, diabetes, end-stage liver disease, ESRD, severe hematologic disorders, HIV or AIDS, high blood pressure, chronic lung disorder, chronic and disabling mental health conditions, neurologic disorders, and stroke. So you can see there's a lot there to feast on, so to speak, for the member to qualify for those additional benefits. So earlier in the presentation, I talked about the partial DSNP plan and the MAPD plan having comprehensive dental coverage. It's a little bit different in 2024 because it's flexible. They get $1,000 per year for comprehensive coverage. It does not cover implants, but it is loaded on additionally to that debit card. So they do not have to use DentaQuest for the comprehensive coverage on the dental options plus as to how we filed dental this year. So that's a little bit new and exciting for 2024. What's also new and exciting for 2024 is the VBID. Value-Based Insurance Design is what VBID stands for, if you didn't know. And in essence, this slide says that we filed with CMS the ability to improve the accessibility of drugs to members by eliminating the cost sharing. So basically, it has to be it's only on DSNPs and has to be with LIS as well. So DSNP members with LIS will pay $0 on any tier for drugs, unless that particular drug is not in our formula. The Molina Marketing Store is something new that started right before or at the time of AEP last year and into this year. If you've ever been on one of our trainings, either locally or nationally, we do a training on the Molina Marketing Center. What is it? It is how you are able to get marketing materials on your own. It's like online shopping in essence. How do you get this? Well, you have to be contracted with Molina Healthcare in order to do that. If you're not contracted, you won't have access. So once you get contracted, you get access. How do you get access? You get an email. The email is from YGS, which is a vendor for Molina Healthcare. That email that you would get from them is no reply at the YGS group. I'll repeat that again. No reply at the YGS group. Once you get this email, you will have a link to this, the Molina Marketing Center, in which you'll be able to order kits, as well as flyers and a whole bunch of other things as well. If you don't get it, the email, you should check your spam. If you don't get that, you need to clear your cache, then wash, rinse, repeat, check your email and your spam. Again, if you don't get it, please let Giovanna or I know, and we will submit a ticket on your behalf to get that email. This kind of puts the power back in the broker's hands so they can order their stuff on their time, as opposed to contacting the BSU or Giovanna or I to do that on your behalf and have to wait. So you can do this in the middle of the night, first thing in the morning, or right before you go to bed, or anywhere in between. There could be a cost to it to you, so keep in mind that there is also a possibility that we could cost share or pay for it for you if there is a cost, but we would have to get approval. They look at these approvals probably once a week, and typically, this is, again, commentary for myself, I think when the committee looks at whether they're going to approve a cost relative to sharing or paying for your marketing materials, they will probably look at how much you are writing with Molina. The MAC is our Molina Agent Center. That's the acronym for the MAC, Molina Agent Center. It's actually molinaagentcenter.com. I'll repeat it again, molinaagentcenter.com. You need to bookmark this page on your laptop, your desktop, and or your phone, because this, you don't need a username or password like the Molina Marketing Store. It is a public domain website. I don't know why anybody that's not a broker would come to this page, but this is all things for brokers, only on the Medicare side. It has a tremendous amount of things and valuable information for you. What is on here? Well, there's basically 3 tabs. There's a training tab where you can find out local events for each specific market. Giovanna and I have events running all the time, both virtually and in person. How can you find out about that? Through the MAC. Other states have it as well. If you hit on the events tab, those are national trainings. There are a couple of national trainings coming up, both on enrollment options as well as the new broker portal, which just was released very recently. And then finally, resources, as I mentioned before, it's a wealth of library information on Molina Healthcare. I suggest that you as brokers spend time just diving into the MAC. Contracting and certifications coming up for 2025. When? Thank you. When? We don't know yet. Historically, it comes out in July. If you're not contracted with Molina Healthcare right now, if you do get contracted at some point down the road, when our 2025 certification comes up, it will cover you for both 2024 and 2025. As most carriers, not all carriers, Molina Healthcare traditionally does require you complete the AHIP before our certification. Again, historically, our certification doesn't take long, probably anywhere from 10 to 20 minutes, because it probably has 20 questions on the exam. That being said, if you haven't received the email, I'll just tell you guys that we have a blackout period. That blackout period this year runs from June 1st to July 8th. What does that mean? That basically means you have to get in your contracting information, in this case to IAD, and they have to get it to our contracting people before June 1st. If they get it before June 1st, it will get done. It will get done. If it comes after June 1st or anywhere between June 1st and July 8th, it won't get done. And basically, you'll have to start the process completely over on July 9th. Our BSU, in my opinion, is the best in the industry. I get nothing but rave reviews, and I'm sure Javon does as well, from our BSU. They are typically open Eastern Standard Time from 8 to 8, Monday through Friday. And these are just some of the things that they can do for you. In essence, they are the customer service to you as a broker. By the way, this page you really don't need to memorize because there's a bunch more emails and the phone number is on the Mac. These are some important links. I talked about the Mac, the formulary lookup tool, and the pod up at the top. Those can be found on the broker portal, and the broker portal should have a new link. Again, that was because it just got released. I don't have it on me, but I can tell you the link to the broker portal can be found on the Mac as well. We are in SEP territory, so to speak. So keep in mind that this is when you can sell. This is the time to sell. Now that all the dust is settled, we're through AEP, we're through OEP, where we can hunker down, and you as the broker can really start to branch out to other carriers like Molina Healthcare. Molina Healthcare has multiple products, but specifically we're a DSNP industry leader, which means you can sell us year round. These are some of the various SEPs that are always available to you throughout the whole year. We're in lock-in season right now, which will last from April 1st through September 30th. So now's the time. Please reach out to Javon and I on ways that we can assist you enroll in Molina during the lock-in season. One SEP of note that just came out today that we are honoring is a declaration state of emergency. That just came out because of the tornadoes that were in West Michigan. So the counties that are impacted are Branch, Cass, Kalamazoo, and St. Joseph, although out of those counties, Kalamazoo is the only serviceable county for Molina Healthcare in 2024. Another reason, as we kind of take the plane home and give any thoughts to Molina, we're just going to spend the time telling you why Molina. Member services is one of the reasons why we have a great member services team that works with our members, and these are some of the things that they can do for the members. This is their phone number, which I promised to you. It is 800-665-3072. That's 800-665-3072. Another reason has to do with our case managers. Not only do they authorize those additional benefits if the member qualifies for the food and produce and SSBCI, but they also help the member throughout the member's lifetime on trying to get them healthier. So they are the real reason why to purchase Molina Healthcare, to have someone almost as a health coach. As you can see, they do conduct telephonic, face-to-face, or home visits, but they're also always developing a plan in order to try to get that member healthier, which is why you purchased, or why the member enrolled in Molina Healthcare to begin with. And then finally, we developed over the last couple of years a concierge team. Just like when you go to the hotel and you have a concierge person who's basically there to tell you everything, not only about the hotel, but about the local area and places to go and visit if you're on vacation. Kind of the same concept with our concierge team. They're more of a proactive customer service team. They will help on the front end, trying to make the new member feel comfortable. They will contact the member right before their plan goes into effect. They will follow up 90 days later. And also on the back end, if there's any issues with the member, this is who the member would contact if they have a problem with something relative to their coverage or anything else about Molina Healthcare. They also extend that service to you as the broker. So as we kind of really land the plane here, Molina Healthcare is a very conservative company. As you can see, over the last 3 years, it's really been about the debit cards and the free benefits. And Molina Healthcare, while they have that, it's never been about that. It's been about sustainability, profitability, and really being able to be in the market. A lot of our competitors over the last 3 years and moving forward, you can see they try to eat up market share. There's a cost for the high utilization with those specific carriers. It's a game that Molina Healthcare doesn't want to play. They like to stay in their lane. They're a niche company. They want to get their piece of the pie in the niche. And really, relative to a fabulous network, a high retention rate, an excellent broker and customer service, why else would you not use Molina Healthcare in your portfolio relative to selling us? So that concludes the presentation. So I will turn it back over to Sharon and ask if there's any questions for 𝗬𝗏 and I.
I'm so sorry, excuse me. Thank you, Jonathan. I think that was a pretty well covered realm for the Molina plans. And I didn't see any questions in the chat. Folks, if you do have questions, go ahead and either enter in the chat or the Q&A box, whatever is more convenient for you. However, I think I will just bring up a couple of questions. Is there a way to get the SSBCI qualification verified without doing the HRA? Obviously, when that stops being paid for, people may not think to do that. So I'm
Good
wondering.
question. I can't answer the question for when the HRA goes away yet, because I don't know what the process looks like. But I can tell you for today. So for today, if the broker doesn't complete the HRA and the member still wants to qualify for, they still contact member services.
Okay.
It's the whole process is the same, except now the case manager is doing the HRA.
Okay.
So really, you're just taking the broker out of it, and the broker's not getting paid $100 as long as we continue to pay the $100.
Okay. And that case manager doesn't only get in touch with them if they've seen an HRA come through. They're going to get in touch with them because they're signed up for one of those appropriate plans with the DSNP then, correct? Does that make sense? Okay.
And the choice care, the 006.
Right.
Yep.
Right.
And
Okay.
but keep in mind, the member's the one that is the proactive person in that.
Right, of course. Yeah, because I know there's a lot of instances where folks, well, I don't even know, do I qualify? Do I get those extra benefits? Can I get my food, you know, and whatnot? So, so I just wanted to see if we had an answer for that. But I'm sure if there is a change to that, you guys will find out about it when all of us do, when the new plans come out and whatnot too.
I might find out at the same time.
Yeah, exactly. And then that would be the same in regards to the Inflation Reduction Act changes as well, that if there's anything with that, especially when it comes to formularies and that sort of thing.
Yep.
Obviously, we don't know ahead of time. We never do.
The whole
But
industry
I would just say
is in this like hold right now. So
yeah, and I would just say, and I'm sure you'll agree, it's very important to go through their drug plans this year to make sure that, you know, that they do a review of that for everybody, whether they usually do it every year or not. This will probably be one of the most important times to do that this year. So absolutely. So I don't see any questions there. So is there anything that either you or 𝗬𝗏 wanted to add on at the end here?
I don't. Do you have anything, 𝗬𝗏?
I do not. No, I think we covered everything pretty well.
Yeah, I think the presentation covers things pretty 100% there. Yeah. All right. Well, I thank both of you for joining me today, and we're going to get this recording out to everyone that did come to the presentation, as well as a list of folks that I have to get it sent out to, and it will be available on our YouTube channel page shortly as well. So thanks again, Jonathan, 𝗬𝗏, and I will talk to you both soon. And thank you everyone for joining us today. All right.
Thank
Bye-bye.
you.
Thank you. Bye-bye.